Good evening, friends. Am I audible to you? Hi, am I audible to you? Yes, thank you very much, Balaji Tiwari and Shashruta. So let me tell you this is a fun time. We will be trying to learn something in anatomy, physiology and biochemistry at the same time. We'll have a quiz contest here, and this will be requiring menti.com. Please parallelly open menti.com on your pages also, while I'll show you this particular slide here. Okay, before we start, let me tell you about myself. I'm Dr. Meenakshi Sundaram here. I'm Dr. Meenakshi Sundaram AS, MBBS MD in gold medal and MD exams, and I'm a high octane educator in microbiology and biochemistry for the past 11 years, and I've been successful in placing students in the top tier institutions for the past 11 years consistently. Even this year, in the NEET exam, out of the top 100 students, at least 17 students are mine, and prolific quiz master, international and national. So there is a plus subscription happening, and there is a physiology exam today that happened at 11 a.m. and Iconic subscription is available. If you'd like to subscribe to Iconic subscription, please use code DRASM live if you'd like to have a 10% discount and exclusive access to all my classes. And these are the special class features. Interactive live classes, polls for the learners, raise a hand feature, never miss a class, lecture notes anytime anywhere, access to the classes, and there's an updated and highly effective question bank. 25,000 plus high yield clinical questions are available for you, and these are the NEET PG toppers. The pictures may not be clearly visible, but these are our NEET PG toppers, and NEET PG combat is happening, and there is a raise a hand feature, and there are two batches happening parallelly, Focus FMG 2022 and Target NEET PG 2022, and from November 23rd till November 24th, and there is a session where you'll be having one more thing till December 1st. You'll be having a session where 1 minute. Yes, there is a November 29 till December 1st. If you'd like to subscribe to Unacademy for 24 months, you get 4 months free. For 12 months, you get 2 months free, and for 6 months, you get 1 month free. Please use code DRASM live, and this is the rates for the plus subscriptions here, and these are the rates for the Iconic subscription. And this is to just inform you about what is happening. So shall we play? Please say yes if you're ready for the Menti quiz. Wow. Okay, thank you very much, people. And can you see on the top there is a code 878998. Please go to menti.com. All of you, please go to menti.com. Yes, please go to menti.com and use the code 878998. Please use the code 878998. Please go to menti.com, menti.com, and use the code 89. I'm sorry. Please use the code 878998. You will be given access to start the quiz contest. Okay, I repeat. I think you're not able to see the slide. Can you see this? Menti.com 878998. This is the code. please go to menti.com. See, the best way to play this game is to be live on YouTube and also have a parallel device which can help you log on to menti.com. In that particular website, there will be only some small bar. If you click on the bar, you'll be able to have access. Give some kind of name for yourself and you'll be able to play it. So shall we begin? Let's go for the first question here. Okay, so let's start the first question. Answer fast to get more points. Look at your device. Look at your device. What is the clearance of a substance when its concentration in plasma is 10 milligrams per deciliter and the urine is 100 milligrams per deciliter and the urine flow is 2 ml per minute? And the urine flow is 2 ml per minute. Yes. So you have 2 seconds. Let's see how many of you have answered. 57 people have turned up the answers. So 43 people have given the right answer. So what is the formula you use, people? What is the formula you use? What is the formula you used? Can you please tell me which formula did you use? You went for UV by P. Here in this particular question, urine flow was 2 ml per minute. Now you multiply that with plasma concentration, which is 10, and it is divided by multiplied by the urine concentration, which is 100, and then you divide that by 10, so that you will be able to get 20. The right answer is 20. Excellent. Nikunj Agarwal, are you not able to see this? Nikunj Agarwal, are you not able to see what I am writing? Please let me know. See, in case of your MBBS exams, you are bound to have MCQs in the upcoming CBME curriculum. That is competence-based medical education curriculum. Whatever college you are in, you have NMC right now, National Medical Council guidelines that support CBME. All the syllabuses have had CBME with MCQs in it. Nikunj Agarwal, please tell me what is the problem. I'll try to rectify it. Okay, so let's look at the leaderboard here. Jwala is on top, Vaishnavi second, Shanmita third, Balaji fourth, Lola fifth, Shamita sixth, Yes 7th, Farha 8th, Master the Blaster 9th, and Kripa 10th. Excellent playing, all of you. Very well played. Let's go for the second question. I am not visible. See, on the YouTube channel I am visible. If you're going to menti.com, I will not be visible. You try to answer. Can you see the questions? That is what I want. Ajay Patel and Nikunj Agarwal, can you see the questions? Please tell me yes or no. Others, please pitch in. Please tell me what is happening. Others, please help me. What is happening? What is wrong? Okay, if you are able to see the question, that is more than enough. That is what we want. And if you want the explanation, you can look at the C. You are trying to switch between 2 things. Remember this, you're trying to switch between 2 things. One is YouTube, the other one is menti.com. It is slightly difficult, but if you can overcome this, we can have a great game in our hands. So we have just gone for the first question. We still have 31 questions to go for. And if you are prepared for your MBBS exams, if you are starting to prepare for the exams, I will be teaching you the answers also. I'll be giving you the answers also. You can play very well. Okay. Questions are not visible. Nikunj Agarwal, the questions are visible only if you go to menti.com and use the code. I told you, right? See, I'll write it once again here. Nikunj Agarwal, please go to the website called as menti.com. In that, there'll be a small box. In that box, please fill the code 878998. When you fill this box and then you click on it, then you'll be able to have access to that. Is that okay? Yes, okay, thank you very much. So let's go for the second question. See, initially it will take some time to adjust to it, but later we all will be able to go past it. We are going to the second question. Come on, second question coming on your screen now. Answer fast to get more points. What does linea semilunaris mean? Is it the curved area inferior to the costal rib? Is it the curved fold superior to the squamic symphysis? Shallow curved groove lateral to the lateral margin of rectus sheath? Curved aponeurosis inferior to the umbilicus? Curved aponeurosis superior to the umbilicus? Among the 5 options, which one is linea semilunaris? Linea semilunaris. See, the whole thing is lunar. Semilunaris, half the lunar face of the moon. Okay, that is the logic. Okay, we have received 71 answers. Yes, thank you very much, Nikunj. Thank you for your patience. Okay. Okay, something went wrong. I think the answer was not taken into consideration. The answer is 2. Yes, Vaishnavi, Shamita, yes, Farha, Master the Blaster, Kripa, Brinta, Farha, okay, Mahesh, Ramya. So the answer is option number C. The answer is option number C in the rectus sheath area. Let's go for the next question here. Yes, question 3 of 32. Answer fast to get more points. The anterior wall of inguinal canal is formed by the linea alba, rectus abdominis muscle, transverse abdominis muscle, internal oblique. Which one? The anterior wall of inguinal canal is formed by the linea alba, rectus abdominis muscle, transverse abdominis muscle, internal oblique muscle. Which one? We have 20 more seconds, 18 more seconds. Okay, so the right answer is internal oblique. The anterior wall of the inguinal canal is formed by the internal oblique. Let's see how many of you have gotten the right answer here. So how many of you are on top? Some of them. Okay, there is a shuffling. Okay, Vaishnavi still retains top position. Shreya second, Brinta third, Farha fourth, Pradeepa fifth, Harini fifth, sixth, Sai Priya seventh, Sri eighth, Abhinav Senthil Murugan ninth, and Ambrish 10th. Okay, there is a small technical glitch. We are not able to see the leaderboard on the YouTube channel, but the leaderboard will be available on the menti.com page. Let's go for the next question here. Let's go for the next question. Question 4 of 32. Answer fast to get more points. All nerves pass anterior to the quadratus lumborum muscle except subcostal, lumbosacral, iliohypogastric, ilioinguinal. Which one? All the nerves pass anterior to the quadratus lumborum muscle except subcostal, lumbosacral, iliohypogastric, and ilioinguinal. We received 49 answers. Anybody else? Yes, now we are able to see the questions here. We have 3 more seconds. We received 76 answers right now. Time is up. Okay, the right answer The right answer is lumbosacral, which is most commonly given as the answer. 43% of the people are given the right answer. Wonderful play, well played people. Yes, very good. So are you all comfortable right now, people? One simple question, are you all comfortable? Are you all comfortable with the questions? Do you want something to change? Are you all comfortable playing this? See, this is just a game and you should learn medicine with fun. Medicine should be fun, medicine should be intense, it should be lovable. That is my ultimate goal of keeping this particular kind of quiz contest. And if you have any of your friends or your seniors or your siblings, ask them to tune in again at 9:30 p.m. tomorrow. It will be for second year MBBS subject questions, and tell me when can I keep the first year MBBS subjects quiz like this again. Okay, so in the comment box section, please comment below. You will be preparing again. When you are confident of reading all the subjects, come and tell me again, we'll do it. Let's look at the leaderboard here. Yes, now I think some shuffling might happen. Okay, so Vaishnavi has given the fastest for this, and Vaishnavi is on top, followed by Brinta, Harini, Farha, Sri, Jwala, Sneha, Abhinav, Senthil Murugan, Shruti and Shanmita B are the top 10 people. Okay, let's go for the next question. Come on, let's play. So, question 5 of 32. Answer fast to get more points. What are the main features of the left lung? What are the main features of the left lung? It is structured in 2 lobes, it is structured in 3 lobes, has 1 horizontal fissure separating superior from inferior lobe, 2 fissures are visible on its surface. Among the following 4 options, which one is a true statement? What are the main features of the left lung? Okay, we have 5 more seconds. Okay, so 40% of the people have given the right answer. It is structured in 2 lobes. I believe all of you would have at least gone once in your life for Kaun Banega Crorepati shows in the TV. You would have watched it. And there is a lifeline option where they can go to the public poll. Yes or no? When you go to the public poll, the maximum number of, you'll be having a bar diagram or the histogram they say. The maximum number of people, if they have voted for one option, you can go behind this, because the most number of culminative knowledge, the culminative brain features come together, can come towards the right answer. So here you understand most of the people have given the right answer. Is structured in 2 lobes. It is very rarely that when the maximum number of answers are given right and that option becomes wrong. So let's see who's on the leaderboard here. Okay, so Farha would be topping this particular question. Yes, Farha is on top, Jwala second, Vaishnavi R, Abhinav, Shruti, yes, Shanmita, Master the Blaster, Farzana, Mahesh. Okay, so with every single question, some people in the top 10 are moving out of the top 10, and some people from outside the top 10 are able to come into it. This is how the competition is, and please take it as a game. Do not feel distressed if you're not in the top 10. If you're not in the top 10, you don't have to worry at all. Because once you're not in the top 10, your name will not be showing up. You can make as many mistakes as possible. But once you're in the top 10, there is a pressure of maintaining and gluing on to the top 10. That is what is supposed to drive you forward. Let's go for the next question. We'll see how many of you can actually come forward. Yes, Kushal Gimre, you gave the right answer. Kushal Gimre, thank you for answering, but better please go to menti.com. On the top of this particular slide, it is written go to menti.com. If you click on it, there will be a small box. Use the code 878998 and you'll be able to play the game from now. Okay, not many questions are done, only 5 questions are over. Let's go for the 6th question. Answer fast to get more points. In which mediastinum is the thoracic part of the trachea? In which mediastinum is the thoracic part of the trachea? Is it superior mediastinum, medial mediastinum, superior and medial, anterior, or superior and anterior? Which one? Think twice before you answer. This is about the chest, and if at all you learn this, the way you understand chest and TB department, and the way you will be knowing the cardiothoracic vascular department, CTVS course, will be amazing. When you, there will be some people who will be wanting to become a cardiothoracic surgeon. Cardiothoracic, thoracic means you are supposed to deal with the chest. Yes. Let's see how many of you have given the right answer. Okay, amazing. Again, 34% of the people have given the right answer. It is superior mediastinum. Amazing. So, thoracic part of trachea is present in the superior mediastinum, not in the superior and medial and superior and anterior. See, if this is the superior part, and if you are looking at the anterior or medial, it will be not in a position to actually have enough amount of space with the esophagus. If you want enough space with the esophagus, it should neither be medial nor be lateral. It should neither be anterior or posterior. It should be exactly located in such a way that it is among the posterior area. The mediastinum will be superior mediastinum. Let's see how many of you will be on the top area. Okay, Farah retains the top position, I believe. Okay, Farah is on top, Abhinav second. Shanmita has given the fastest answer for this question. Pradeepa, Harini, Kinjal, Brinta, Saipriya, Swarnamukhi, Jwala. What is this? There is only one boy in the top 10. Come on, boys. Where are you all? Come on, people. Come on. Crack into the top 10. Let's go for the next question. Question 7 of 32. Answer fast to get more points. The membrane potential of a cell is at K plus equilibrium. The intracellular K plus is equal to 150 and the extracellular K is equal to 5.5. What is the resting potential? This is a classical physiologic question. The membrane potential of a cell is at the potassium's equilibrium. Intracellular potassium concentration is 150. Extracellular is 5.5. It is almost acceptable normal levels. What is the resting potential? So in terms, you can read the question like this. If at all the intracellular, extracellular potassium levels are accepted, they are in the acceptable range, and if the membrane potential of a cell is a potassium equilibrium, then what is the resting potential? Come on, people. Yes, again, maximum number of people have actually given, but the only thing is, this is a small area where you have to understand minus 90 millivolts will be the right answer. Minus 90 millivolts will be even lesser than the other irregular minus 70 millivolts. Can you please tell me minus 70 millivolts is the resting potential for which kind of membranes? This is one example of the crowd majority going wrong. Excellent PKH. The answer is minus 90 millivolts. But if you could use the menti.com and then answer, it will be amazing. Come on, tell me. Minus 70. Okay, what is the cardiac membrane resting membrane potential? What is the cardiac myocyte resting membrane potential? Can anybody tell me? Minus 90 millivolts is the resting potential of which kind of cell? Yes, it can be. No, very good. Okay, let's move forward. Let's see who is on top. Yes, correct Sumati, correct Sushruta and Hemalata. Now Harini is the fastest and Harini is on top. Saipriya second, Jwala third, Farha fourth, Abhinav fifth, Shanmita sixth, Vaishnavi 7, Pradeepa 8, Shinchan 9th and Kinjal 10th. Let's go for the next question here. Question 8 of 32. If a child inhales by mistake a foreign body, in which bronchi is it most likely to get stuck? Right superior lobar bronchus, left inferior bronchus, principal right bronchus, principal left bronchus, left superior lobar bronchus. Kannan Sivakumar, that's a wonderful answer, but try to answer using menti.com. Your answer can get marks for you so that people can know how much you're scoring. Yes, the right answer is right principal bronchus. Can you tell me why, people? Why right principal bronchus is the right answer? If a child inhales by mistake a foreign body, which bronchi is most likely to get stuck? Which the foreign body gets stuck in which bronchi? They're saying it is the right principal bronchus, the main bronchus of the right side. Why? Because the main right bronchus is actually more straighter down the line compared to that of left. So when a foreign body enters inside, the gravitational force itself, it can automatically go to the right bronchus. Yes, angle, very good. Not narrow, it is straightened. It is not narrow, it is a straighter one. The angle is actually more straighter. Okay, let's go for the next question. Yes, correct. Next question. This is the leaderboard now. Yes, Sai Priya is on top, Farha second, Vaishnavi third, Harini fourth, Brinta fifth, Kinjal sixth, Kripa seventh, Shirley eighth, Swarnamugi ninth, and Sneha 10th. Oh my God, now this time all girls. Where are the boys? Come on boys, come on. Question 9 of 32, okay? Answer fast to get more points. At the level of the wall of which structure the myocardial muscle is best represented? Right atrium, left ventricle, left ventricle. It is represented in the same way at all levels. A myocardiac muscle is better represented at which wall? Right atrium, left ventricle, left atrium, right ventricle, left ventricle. It is the same way at all levels. Which one? Kannan Sivakumar, again a suggestion. Please go to menti.com. Please go to menti.com. You can see that on the top of the screen here. Go to menti.com and use the code 878998. You're giving wonderful answers. You're giving amazing answers, but the answers will not get marks if you don't go there. If you'd like to join this, even it is not too late. It is only 9 questions out of 32. If you could actually stay with us till the 32nd question, you may be coming on the top. For that reason, please try to go here, because menti.com will keep track of your right answers. It also will keep track of how fast your answers are. The only reason you're going for menti.com is it is easier to track. For example, if I put forward a question and I have to track all the 90 people or 110 people who are giving the answers, I have to see who is giving the fastest answer or slowest answer, and for every fastest answer the answers marks will also be higher, right? But if I use this software, it will be easy for me to know who is on top. For that reason, it's a request, go to menti.com and use the code 878998. And again, here the majority wins. It is the left ventricle. Left ventricle is the best place where the maximum contraction happens, and the myocardial muscle is best represented, okay? Not better, it is best represented. Let's go for the leaderboard here. So Jwala is again coming back into the game. Okay, so Sai Priya, Farha, Vaishnavi, Kinjal, Kripa, Swarnamukhi, Jwala, Shirley, Sneha, Shruti. Boys, come on boys, somebody try to break into the top 10. Abhinav, what happened to you? Okay, question 10 of 32. Let's start again for question 10. Answer fast to get more points. What structures can be found at the level of the anterior wall of right atrium? At the level of anterior wall of right atrium. Tricuspid wall, bicuspid wall, mitral wall, fossa ovalis, coronary sinus. Which one? These are slightly difficult to answer if at all you haven't gone through the relations and the levels. But levels are actually good to know if at all you want to become a cardiothoracic surgeon, especially when it comes to the levels along with the heart. When it comes to esophageal level, tracheal level, all these things will make a difference when you become a surgeon. Okay, let's see how many of you have given the answer. Okay, tricuspid valve gets the maximum number of answers, and that is the right answer. So remember, when you look at the whole heart, remember, when they show you the heart beating like this, it is not the way heart actually beats. Heart has a vortical rotation. It is a vortex. Imagine this. If this is the heart rotates like this. It beats like this. This is how the heart beats. I repeat, this is how the heart beats. One portion comes forward and again goes backward. One portion goes forward and again goes backward. So while you're looking at the right atrium, the anterior wall of the right atrium at any given point of time will be on the same level of tricuspid valve, is what you have to remember for your exams. Okay, so look at the leaderboard. We'll see how many of you have come forward. Yes, Lakshya. RN and Zach Knight, again it's a request for you, please use menti.com. You will be able to score marks. Your marks will be counted so that you can come on the top. Farha, Kripa, Jwala, Sai Priya, Shruti, Vaishnavi, Kinjal, Santa, Ramya, Swarnamukhi. Santa, okay, Santa has given the fastest answer for this. Are you a boy or a girl, Santa? Code is 878998. Kannan Silkumar, the code is 878998. Please try it. 878998. Okay, let's go for the next question. If you still can't catch my words, it is seen on the top of the screen. Okay, question 11 of 32. Answer fast to get more points. The mitral valve is located between the following chambers. Which are the following chambers? Between right atrium and right ventricle, left atrium and the left ventricle, right atrium and the left atrium, left ventricle and right ventricle, left ventricle and the aorta. It looks like the primary level questions in Kaun Banega Crorepati, like 1,000 rupees value question, 2,000 rupees question or 5,000 rupees question. It's a simple question answerable by school students also, so do not make a mistake in this. Okay, so here again we get the majority. 63% of people have given the right answer between the left atrium and the left ventricle. There's not much of a description for this. It is understood from school. So let's see who is the leader here. At these type of questions, if you're faster, you make a difference. That is what happens. Okay, Farha retains top position again. Kripa is second. Jwala is third. Jwala has again pushed back into the area. And Shruti, Sai Priya, Vaishnavi, Kinjal, Santa, Ramya, and Swarnamagi. Santa, are you a boy or a girl, Santa? Please let me know. Question 12 of 32. Let's start. Answer fast to get more points. The innervation of the serratus anterior muscle is done by? You speak about the nerve supply. Is it the medial pectoral nerve? Is it the lateral pectoral nerve, long thoracic nerve, axillary nerve, or musculocutaneous nerve? Which one? Serratus anterior. Serratus anterior. Think about the serrations and think about the activity or the functions of serratus anterior. These all are evolutionarily very old muscles, like quadratus lumborum, rectus abdominis. If you think about serratus anterior, latissimus dorsi, all these muscles are muscles of equilibrium and they can maintain your posture. So here again, the majority is giving us the answer. 68% of the people are given the right answer. The answer is long thoracic nerve. So those people who get the question answer wrong, do not worry, it's a learning procedure. Whatever kind of question you're seeing here are just questions which are similar to the questions which can be asked in the Vivos. What I did was I tried to go through the logic on the common questions asked for you, and those questions slightly twisted into an MCQ. If you could answer these questions, you are very well ahead of other students who are not even trying to answer these kind of questions. You have come here. If you make a mistake, it's okay. So if you get the question right, it is okay. If you get the question wrong, it is double okay. Why? Because you are going to learn something new. You will remember this for your exams. Now you tell me, people. Yes, you tell me, people, if at all I keep another session like this, will you be okay? Will you be able to come back? And tell me if you are interested in another quiz contest. If that is so, I will give you enough time to prepare, again come back and fight. This time, the next time I'll give you some tougher questions. If you're interested, let me know when I can have the quiz. Oh, Santoshi Priya is Santa. Okay, so all top 10 are girls. Okay, girl power is amazing right now. Where are the boys? Boys, come on, boys, come back into the top 10. Okay, at least one of you, please. Yes, can you please let me know when would you want to have the next session like this? See, tomorrow's session is 9:30 p.m. is for second day MBBS subjects. So if you would like to have such a Menti quiz session, please let me know when I can have the session for you again for first MBBS. If you're going to prepare for, this is the study holidays, right? In the study holidays, you'll be trying. Why did I come up with this idea? Because when study holidays start, you will be preparing for model exams. You'll try your best. But after the model exams are over, you'll hit a rock bottom because everything will become very monotonous. But if some kind of push is given to you, you will be able to read better. So tell me when approximately can I get the next session? I'll do it for you. Can you tell me this? Now I'm waiting for an answer. Can you please tell me when would you want approximately the next session? Zach, tomorrow night we'll be having the second MBBS quiz contest. Jwala has hit the top again. Sai Priya second, Kripa, Shruti, Vaishnavi, Farha, Santa, Kinjal, Sneha, Swarnamagi. You're a boy on my way, sir. Started late. Okay, since 2005. Come on. Fires Hussain, December 2nd week. Is it fine? No, tomorrow, the same time, 9:30 p.m., we'll have a session. Tomorrow, 9:30 p.m., we'll have a session for second year MBBS subjects. That is pathology, microbiology, and pharmacology. If people want, we can do for FM also, forensic medicine also, forensic medicine toxicology. So, is it okay? Is December second week okay for you? The end of December second week or third week, will you come back strongly again? Zach Knight, the problem is this is a culmination of all questions. You may give a faster answer, but there may be somebody who is faster than you. If you're the fastest, your name will come only when you are in the top 10. That is the problem. So try again. If you can hit into the top 10 and if you're faster, you'll be able to get the fastest. Okay. Next question. Okay, let's have the next session. December second week or third week. 13th question out of 32. Come on, people. Answer fast to get more points. When does winging of the scapula happen? When does winging of the scapula happen? When the serratus anterior muscle is very contracted, when the serratus anterior muscle is paralyzed, when the pectoralis major muscle is very contracted, when the pectoralis minor muscle is very contracted, when the pectoralis major muscle is paralyzed. Which one is the right answer? I've already received 89 answers. We have 14 more seconds. Come on, people. Hi, Dr. Goblin. Yes, we are doing okay. And I have a request to you people. In case you are enjoying this quiz, at the end of the session, please put a thumbs up. It can help the video stay afloat for a more amount of time. More people can watch it. Those people who did not have time to come live, they also can watch it. So if you put a thumbs up, it will be helpful for the video. And after the class is over, after the session is over, once the live is over, if you have any questions, you can comment on the box. The more the comments, the more the video will be alive. Okay, just if you like the question. Yes, thank you very much. Oh, nice, since 2005. Okay, so let's see how many of you can go for the, okay, let's see the leaderboard. Jwala, Saipriya, Kripa, Shruti, Vaishnavi, Farha, Santa, Kinjal, Sneha, Swarnamukhi. Okay, this is the leaderboard. So Jwala is not giving up a position. Very well played, all of you. Let's go for the next question. 14 of 32. Yes, answer fast to get more points. A patient has a very strong pain just inferior to the xiphoid process. What is the name of that area? A simple question. Is it epigastrium, hypochondrium, umbilical, lumbar, hypogastrium? Come on, people. Some questions will be freebies for you. See, every question carries the same amount of weightage. Some questions can be very tough. Some questions can be dead easy. That is the beauty of a quiz contest. It is not like an exam, it's like a quiz contest. See, the more you actually answer the simple question, you're trying to make a foundation for yourself. There is no point in answering very difficult questions but losing out on simple questions. So make sure you will be able to hit every single question correctly. Yes, the right answer is epigastrium. Immediately below the xiphoid process, the end of the sternum, immediately below the xiphoid process is your epigastrium. Very well played, people. Nice. Let's see the leaderboard here. Yes, I think Jwala is not going to let go of her position any soon. Jwala, Saipriya, Vaishnavi, Farah, Santa, Sneha, Kinjal, Shirley, Kripa, Shanmita, very well played. Let's go for the next question. 15 of 32. We are halfway through it. What does the axillary tail of Spence mean? What does the axillary tail of Spence mean? Elongation of supromedial quadrant of the breast, elongation of the supralateral quadrant of the breast, elongation of the axilla towards the breast, a disease, an island of the tumoral breast tissue located in the axilla. Come on, people. Subiksha, Justin Sharwan, Zach Knight, Amaya Mirza, Dr. Goblin. Zach Knight, try to come through menti.com. There is, if you look at the screen very clearly, on the top there is a website called as menti.com. If you enter into it, there will be a small box. You can enter the code that you can see here, 878998. Your answers will count. Even if you're wrong, it doesn't matter. Nobody will be able to see your wrong answer. But if you're right, the whole world can see. That is the beauty of this kind of quiz. Okay, 69% of the people are given the right answer. Elongation of the supralateral quadrant of the breast. Look at this. elongation of the superolateral quadrant of the breast going towards the arm. It is not the medial part. Some people have chosen that. It is actually it can be a mistake, but it can't be a medial area. The tail will move towards the lateral area. Also, can anybody tell me when can you find tethering of the tail here? Axillary tail of Spence will go for tethering. Can you tell me when the tethering happens? Tethering indicates what? Try to give me an answer if you can. Next one, we'll see the leaderboard here. Okay, so Jwala, Saipriya, Vaishnavi, Santa, Farha, Sneha, Shirley, Kripa, Shanmita, Shruti. Yes, excellent, Kumar. It happens in cancer. It means the fibrous tissue is increasing in the local area and that particular part of the breast is becoming immovable. The tethering means it is so strongly attached to the underlying tissue. It happens in carcinoma breast. Question 16 of 32. Come on, people. Answer fast to get more points. What type of innervation does the breast have? What type of innervation does the breast have? Both sensory and sympathetic, both sensory and parasympathetic, both parasympathetic and sympathetic, only parasympathetic. This is a tricky question. Try to answer this. Very good, Aryan. Very good, Kanan Silkumar. I want to see how many of you can click it. Okay. It came so close. It is sensory and sympathetic. Remember, it's sensory and sympathetic, and whenever there is a touch, if at all the touch is capable of showing you changes in temperature. For example, if it's a very hot or a warm touch or a cold touch, it can actually have piloerection, and that can be a property of sympathetic. So remember, it is sensory and sympathetic. Sensory touch is always present. You cannot actually rule out sensory, but the next thing you have to add and remember is sympathetic innervation. Next question. Okay, so Saipriya, Santa, Jwala, Sneha, Kripa, Shirley, Shruti, Vaishnavi, Shanmita, Farha. Okay, these people are the only people who are reshuffling in the top 10. Others, come on people, try to break into them. And the top 10 people, don't let go of your stand. Question 17 of 32. Let's start. Answer fast to get more points. Hrithik Katwal, Justin Sharavan, Shashikala Nagaraju. I'm really happy you're getting right answers. Try to go through menti.com. What kind of fibers form the great splanchnic nerve? Unmyelinated postganglionic efferent fibers, fibers from the 9th to 10th or 11th thoracic ganglia, myelinated postganglionic efferent and visceral afferent fibers, myelinated preganglionic efferent and visceral afferent fibers. This is slightly difficult. Even to read it requires some time. I want to see how many of you get this right. Great splanchnic nerve, the area that can supply your spleen, kidney, etc. Okay, so even though the majority has come with the answer as 30%, it is not the right answer. This is one rare occasion. The 10% of people, myelinated preganglionic efferent and visceral afferent fibers is the kind of innervation that is called as great splanchnic nerve. They are myelinated, so it means the transmission is clearly controlled. The myelination controls the transmission. There is no loss of your, there is proper insulation, there is no loss of your innervation. At the same time, it is preganglionic, it is efferent and also meant for the viscera like spleen, kidney, etc. Let's go for the leaderboard here. So in the top 10, only 2 people got it right, Vaishnavi and Nitro. So somebody would be pushed out of it. Saipriya, Vaishnavi, Santa, Nitro, Jwala, Sneha, Kripa, Shirley, Shruti, Sharmita. Very well played. Let's see the next question. Answer fast to get more points. What type of organ is the kidney? A very simple question. A very simple question. Is it retroperitoneal? Is it hollow? Is it intraperitoneal? Is it parenchymal? Is it unpaired? Which one is this? What type of organ is the kidney? Okay, Zank Knight, thank you for your answer. What happened, Kannan Sivakumar? You were trying to go through Menti.com. Is it not working out for you? A simple question to Zach Knight, Justin Shravan and Kannan Sivakumar. Are you not able to go through Menti.com, or is it actually becoming difficult for you? Because when you open the slide, it will be easy for you. Is there any specific reason? If you don't wish to, it's absolutely your choice. But is there something difficult for you? I'll try to help you with that. And it's a retroperitoneal organ, and it is not a hollow organ, it's a solid organ. Okay, the app is very slow. Okay, no problem. Or is lagging, I understand. If it is lagging, I understand, if at all at some point of time, but the problem is, okay, no problem. I'm really sorry. My only simple advice is please clear all your cache memory and try to reinstall the app, and if at all is Menti.com and your phone might be slower, and this is the leaderboard here still. Okay, who is Nitro? Nitro, are you a boy? Nitro, are you a boy? Question 19 of 32. Answer fast to get more points. The difference in concentration of H plus in a solution of pH 2 compared with the one of pH 10 is 5-fold. Sorry, pH 7 is 5-fold, 1 by 5 as much, 10 to the power 5-fold, 10 to the power 5 minus 5 as much. What is your answer? If I say pH 2 and pH 7, what is the difference in the concentration of H plus? Is it 5-fold? Is it 1 by 5 times? Or is it 10 to the power 5 times? Or it's 10 to the power minus 5 times? Which one is it? Okay, excellent. 41% people have given the right answer. That's the right answer. Remember, in case of in case of earthquakes, what is the scale to measure the earthquakes? Can anybody tell me? When there is earthquake, what is the scale of measurement? No Satish Bhupati, no Zach Knight. It's called as Richter scale. For example, in one particular area, when they say Richter scale of 6 is recorded, in another area Richter scale of 7 is recorded, it is not 1-fold, it is 10-folds. When from one number to the other number, if you increase, it is 10-fold. And if at all another area, for example, X area is Richter scale 6, Y area is Richter scale 7, and Z area is Richter scale 8, the difference between 7 and 8 is 10-fold. The difference between 6 and 8 is 10 into 10, which is 100-fold. So the pH of 2 to pH of 3 is 10, and pH of 3 to pH of 4 is 100, pH of 4 to pH 5 is 1000, pH 5 to 6 is 10,000, and pH 1000 to that of pH of 6 to 7 is 1 lakh, that is 10 to the power 5 folds. So every time one pH rise is elevated, there is 10 times elevation. It goes in a multiplicative fashion, geometric fashion. Okay, let's see the leaderboard here. Okay, in this yes, Santa is second, Jwala is second, sorry, Santa is first, Jwala is second, Nitro is third, Shruti, Sai Priya, Shanmita, Vaishnavi, Kripa, Shirley, Farha. Nitro, please tell me whether you are a male or female. That is enough for me. You don't have to reveal your name. 10, I think there are 10 girls right now. Okay, question 20 of 32. Answer fast to get more points. Yes, let's move forward. Increasing alveolar ventilation increases the blood pH because it activates neutral mechanisms that remove acid from the blood. It makes hemoglobin a stronger acid. It increases the PO2 of the blood. It decreases the PO2 in the alveoli. The increased muscle work of increased breathing generates more carbon dioxide. What is the answer? I'm so sorry, Kannan. It is not an app, it is just a website. You can use your Google Chrome, I think. Yes. So 30% people are given the answer. It is decreases the PCO2 in the alveoli. Increases alveolar ventilation means it decreases PCO2. That is, you are washing out a lot of PCO2, because of which you will be having alkalosis equivalent. So it is called as blood pH rise. That is what you see in clinical cases like respiratory alkalosis, where a medical student goes into hyperventilation because of anxiety. That is the clinical estimation case. Okay. Okay, Santa, Shruti, Vaishnavi, Shanmita, Sai Priya, Jwala, Shirley, Nitro, Farha, and Kripa. Okay, let's go for the next question. Shall we finish all the 32 questions? What do you say, people? What do you say, people? Shall we finish all the 32 questions or we'll stop? It's up to you. If it's getting late for you, I don't want to take a lot of your time. If you're interested, we'll finish it. Just tell me as fast as possible. See, it's supposed to be a 1-hour session, but if you're interested, we'll move forward. Okay, let's finish. Okay, next question. Answer fast to get more points. In a patient with plasma pH of 7.1, the bicarbonate by carbonic acid ratio in plasma is what? Is it 20, 10, 2, 1 or 0.1? What is the answer? In a patient with a plasma pH of 7.1, the bicarbonate by carbonic acid ratio in plasma is what? You all know when the pH is between 7.35 to 7.45, the bicarbonate to carbonic acid ratio is 20:1. That is called as base reserve. So now what is the answer? Okay, pseudoephedrine, hydroxy, Sumati, Zacnite, Jwala, Fire, Susain, Zacnite, Shirley, yes, thank you. The answer is 10. Please remember, at a pH of 7.35 to 7.45, which is normal, approximately 7.4, take it as 7.4, when there is a proper physiological balance of pH, not natural pH. See, natural neutral pH is 7. Natural neutral pH is 7. But inside the body, neutral physiological pH is 7.4. So, if at all you say 7.4 is the pH, then bicarbonate by carbonic acid ratio is 20:1. But now this is acidotic. If it is acidotic, who should be less, bicarbonate or carbonic acid? Come on, people, tell me. If at all you are looking for bicarbonate by carbonic acid ratio, who should be less when the pH is 7.1? Is it the bicarbonate or the carbonic acid? What should be less? Bicarbonate should be lesser. So it cannot be 20:1. So it can be lesser than that, which is 10:1. Okay, let's go forward. Let's see the leaderboard here. Santoshi Priya is amazing. She is 14847. Shruti, Vaishnavi, Sai Priya, Shanmita, Kripa, Jwala, Shirley, Nitro, Farha. Yes, you're doing great job, all of you. Excellent people. Yes, bicarbonate. Question 23 of 32. Let's move forward. Answer fast to get more points. Come on. Renin is secreted by exactly what? A simple question. Don't make a mistake here. Is it cells in the macula densa? Is the cells in the proximal tubules? Is it the cells in the distal tubules? Granular cells in the juxtaglomerular apparatus? Or there's no option 5. Don't worry about option 5. Cells in macula densa, cells in proximal tubules, cells in the distal tubules, granular cells in the juxtaglomerular apparatus. Which one? Yes, very good. Good, Zacnite, Justin, Srinidhi, Sahi. Here is the granular cells in the juxtaglomerular apparatus. It cannot be macula densa. Can you please tell me what is coming out of macula densa, people? Yes, what comes from the macula densa? Anybody? Okay, nice. Let's go for the next question. So, Shanmita might be overtaking Sai Priya. Okay, so Santa, Shruti, Vaishnavi, Shanmita, Jwala, Sai Priya, Shirley, Nitro, Kripa, Farha. Let's move forward. Question 24 of 32. Answer fast to get more points. all contribute to the beneficial effects of ACE inhibitors in the treatment of heart failure except vasodilation, decreased cardiac growth, decreased cardiac afterload, increased plasma renin activity, decreased plasma aldosterone. Among this, which one is not a beneficial effect of ACE inhibitor? Okay. Okay, so 21% people are giving the right answer. The answer is increased plasma renin activity. Look at this. See, this is a cardiology question. Cardiology question. In that, generally, when a patient is having heart failure, you will be using drugs like ACE inhibitors. Rarely, you can also use beta blockers. The problem here is, whenever a patient is having a heart failure, and if you put the patient on digitalis or digoxin as a last line effort, not regularly used these days, previously when digitalis was used, whenever the heart is pumping abnormally, the thickness of the cardiac valve or the cardiac muscle will actually alter. That will cause cardiac remodeling. A normal heart under pressure, because of these failure conditions, will have a complete remodeling of the shape. Because of its structure, the heart will be altered forever. ACE inhibitors have offered an amazing idea of preventing cardiac remodeling. Now, in this question, they're asking you which is not the beneficial effect of ACE inhibitor. Do not worry about the cardiology aspect. Just look at whether ACE inhibitor is capable of increasing plasma renin activity. ACE can help in the increase in renin activity. If at all ACE inhibitors are used, then there will be a decrease. That is the simplest logic that you can apply for giving us an answer. Let's look at the leaderboard here. Increased aldosterone can happen RN, but it can actually by the reverse, again through an indirect pathway of feedback activation, it can again be decreasing. It can again be increasing. Yes. So Santa, Shruti, Vaishnavi, Jwala, Nitro, Shanmita, Farah, Saipriya, Shirley and Kripa. Okay, let's see who will actually be ending up on the top area. Okay, Jwala, Nitro and Farah have gotten this right. Okay, now Jwala will be making progress. Amazing, Jwala. Santa, Shruti, Vaishnavi, Jwala, Nitro, Shanmita, Farah, Saipriya, Shirley and Kripa. Okay, next question, 25 of 32. We're coming to the end here. Glucose reabsorption occurs in proximal tubule, loop of Henle, distal tubule, cortical collecting duct, medullary collecting duct. Fayaz Hussain, when the heart is failing, it makes last ditch efforts to beat. While it is beating, the cardiac muscle wall will increase, because of which the cardiac area structure will be altered forever. That is called as cardiac remodeling. ACE inhibitors can prevent cardiac remodeling. Okay, so 62% of the people are giving the right answer. That's the best answer. Proximal tubule is the place where glucose reabsorption happens. 99% of glucose reabsorption happens there. Okay, what is the percentage of glucose reabsorption normally? In the tubules, what is the percentage of glucose reabsorption in normal person? Come on, people. Travel foodie, the scope of non-clinical is slightly lesser than the clinical, but every single time when you can choose research and you can go for academics, you still have a huge scope for non-clinical. So I hope I have answered. Yes, 100%. It is not 60 or 70. In a normal human being, glucose should be absorbed 100%. That is called as evolution. Evolution wise, all living beings are actually fighting for food. So when I take food, the glucose is the fuel. I can never allow the fuel to be lost in the urine. So even though it is filtered, it will always be reabsorbed. And when that reabsorption is failing, it can either be because of renal glycosuria, or it can be because of diabetes, where there is hyperglycemia, where the glucose levels are crossing the threshold. Let's go for the leaderboard here. We're coming to the fag end of the session. Those who want to make a difference, come on people, this is the time. Okay, Santa, Shruti, Vaishnavi, Jwala, Nitro, Shanmita, Farah, Shirley, Sai, Priya, Kripa. Okay, excellent playing. Question 26 of 32. Answer fast to get more points. compared to hepatic bile, gallbladder bile contains a reduced concentration of which of the following? This is slightly a difficult physiology question, but try to answer. It contains less bile acids, less chloride ions, protons, glucose, calcium ions. Which is the right answer? Compared to hepatic bile, gallbladder bile contains reduced concentration of which of the following? When you become a hepatogastroenterologist, these kind of information can make sense to you. If you get it wrong, don't worry about it, but 19% people are given the right answer, and that is the right answer, chloride ions. See, hepatic bile, gallbladder bile. You will be having a chloride bicarbonate channel that can be overactive in the hepatic bile, and while the time it comes into the gallbladder, the chloride ions will be lesser than in the hepatic bile. Please make a note of this. If you never knew this, please know it now. Chloride ions are lesser in the gallbladder bile compared to that of hepatic bile. Okay, so Shruti has given the fastest answer of this question among the top 10. Santa, Nitro, Vaishnavi, Jwala, Saipriya, Sneha, Kripa, Shanmita, Farha. And I am receiving an answer. Nitro says it's a boy. So I'm really glad one boy out of 10, at least one boy out of 10 is on the top area. So Nitro is in the third position. Let's see who will finish on the top 5. It's like a car race, like how you play the most wanted game. Okay, come on. Question 27 of 32. Answer fast to get more points. Glycogen is a storage form of glucose. Dash refers to the process of making glycogen, and dash refers to the process of breakdown of glycogen. See, look at the options here. Glycogenolysis, glycogenesis, glycolysis, glycogenolysis, glycogenesis, glycogenolysis, glycogenolysis, glycolysis. What is the best answer here? It is slightly difficult to read the question, I think. I'm sorry. I didn't expect it to be so small lettered. I'm sorry about this. Okay, let's see how many of you get it right. Amazing. Here, I think all of you have been able to read it. It is glycogenesis and glycogenolysis. Excellent. This is a simple question, very simple question. And let's see how many of you got it right and how it changes the table. So, yes. Shruti, Santa, Nitro, Vaishnavi, Jwala, Saipriya, Sneha, Kripa, Farha, and Shirley. Come on, people. They are the same 10 people. Others try to break open into the area. I'm sorry, Zach Knight, I didn't know this. Okay, we still have 5 more questions. Last 5 questions. Are you all ready? And before we go for the last 5 questions, do you have any questions to me? Do you want to ask me something or you want to say something? Please let me know. I'll give you 30 seconds time. I'll give you 30 seconds time to refresh because you have last 5 questions. You can make a difference in the last 5 minutes. It's called as last mile. Whenever you're running a race, there is something called as last mile. You can make a difference. That's what I'm trying to tell you. Breathe easy. Please be on your toes. And if you have anything to ask me or tell me, please let me know now. Yes, you're welcome for this, Kannan Sivakumar. Thank you very much for coming online. And if you have any of your classmates or any of your seniors or any of your siblings, please ask them to come tomorrow for second MBBS quiz. It will be helpful for them. I am from Coimbatore, Tamil Nadu. Any other questions? Oh, much love from Nepal. Much love from India back to Nepal. Pseudoephedrine hydroxy. In case you'd like to share your name, please let us know. Okay, thank you, Karan Sivakumar. And all of you who are here, every year, I'm from PSG MSR. Every year, we'll be conducting an annual quiz contest in biochemistry, where at least 200 to 250 teams will turn up. Every team will be maybe up of 3 students. We'll have all the 200 teams to 250 teams fighting up to the top 12 positions. We'll be making 2 semi-finals of 6 and 6 teams, and from each semi-finals we'll take 3 people, and in the afternoon session we'll be having 6 teams fighting out in the first round, and at the end of the first round we'll be having a wild card round, and then we'll be taking one more team. So 7 teams will fight out in the remaining 7 rounds. It'll be a high octane area. The only problem is in the pandemic, because of lockdown, we were not able to have any face-to-face quiz contest, but I'm glad that Unacademy has given me a chance to meet out all of you. So thank you very much. And pseudoephedrine, if you could like to share your name, please tell us. Thank you very much. When we have a real-time quiz contest, all of you are welcome to attend our quiz. So let's go for the last 5 questions. Come on, people. Yes, we'll do it. Question 28 of 32. Answer fast to get more points. Which of the following produces the most high-energy phosphate compounds? It is aerobic metabolism of 1 mole of glucose, aerobic metabolism of 1 mole of glucose, metabolism of 1 mole of galactose, metabolism of 1 mole of amino acid, metabolism of 1 mole of long chain fatty acid. Which one can produce the most high energy phosphate compounds? Zach Knight, I'm really sorry. When I typed it, it came in clear words, but on the app something has happened. But if you look at the, see, Zach, you are looking at it on the YouTube phase, right? That is why it is coming like very small. But others, when you're looking at it on the Menti page, you're able to see the words clearly. Can you tell me? Others on the Menti page, are you able to see it clearly? At least can you read the options? Yes or no? Yes. Okay. See, we are speaking about metabolism of anaerobic metabolism of glucose, galactose, anaerobic metabolism of glucose, galactose, etc. We are looking for most high energy phosphate compounds. When you actually break down 1 mole of a fatty acid that is actually present in a long chain fatty acid, for example, you have palmitic acid, you'll be able to get 108 ATPs or 106 ATPs according to the different kinds of rules. So that gives you the most number of high energy phosphate compounds, a simple logic, okay? But the twisting in the question or the way in which the question has been framed, it might actually slightly tip you off. This is just to show you it is a simple question, it is nothing very great. I asked you the question slightly in a different note. It is not supposed to make you fall in the exams, because when you go for the Vivavos, the external examiner might try to trick you by using simple questions like this. So don't fall for the gimmick, okay? And we'll see the leaderboard here. Even the best of the minds, when they are actually under stress, may make mistakes. I do not want my students to make mistakes like this. Kanan Sivakumar, 9.35 kilocalories. Speaking about the calorific value, what we asked was the number of ATPs that can be generated. Okay, Shruti, Santa, Vaishnavi, Sneha, Nitro, Kripa, Jwala, Sai Priya, Shanmita, Farha have been the right answers. I mean, are the top 10. Yes, please come to Seshagopalan. Thank you very much. We'll be conducting. Please come. You're welcome. We'll be sending out the posters and the brochures sooner. Okay, cells responsible for innate immunity are activated most commonly by, it is glucocorticoids, pollen grains, carbohydrate sequences in bacterial cell walls, eosinophils and thrombopoietin. Among the given options, the cells responsible for innate immunity are activated most commonly by which of them? Excellent, Zach. You got the right answer. The answer would be carbohydrate sequences that are present on the surface of bacterial cell walls. Excellent. So remember, if you're looking for innate immunity, that is natural innate immunity coming from within, it is not against anything else, then even for that, it can be activated through that of external infections by bacterial carbohydrates. But among carbohydrates, proteins and lipids, who is a stronger antigen? Can anybody tell me? Yes, Zach Knight, Justin Shravan and pseudoephedrine hydroxy, all of you are right. Tell me, among proteins, carbohydrates and lipids, who is a stronger antigen? Does anybody know who is a stronger antigen? No, the answer is proteins. Proteins Below that peptones, and below that peptides, and then comes amino acids. These are in the order, in the sequence in case of very strong antigens. Carbohydrates are relatively poorer antigens. Lipids are the weakest antigens. Nucleic acids don't even qualify for antigenic activity. Okay, let's go for the next question. Leaderboard first. So Santa, Jwala, Cypriya, Shanmita, Shirley have given the right answers. This might change the order. Santa, Shruti, Vaishnavi, Jwala, Cypriya, Sneha, Nitro, Shanmita, Kripa, Shirley. Out of 10, Nitro is the male, everybody else is a female. Great going, girls. Okay, boys, come on, people. The next quiz contest, I would like you to top the area. Question 30 of 32, the last 3 questions. Type 1 diabetes mellitus patient treated effectively with insulin. The emergent symptoms in the patient reflects failure of which immune process? Is it antibody synthesis? Is it neutrophil chemotaxis? Is it antigen presentation? Is it tolerance? Or is it complement activation? Among them, which one is failing? Among them, which one is failing? Even I am actually trying to squint my eyes to see it, because here it is not very clear. Okay, the right answer would be tolerance. Please remember, in type 1 diabetes mellitus, even though he is treated effectively with insulin, the symptom that can actually happen as an immune process would be the tolerance is failing. When the tolerance is failing, autoimmune activation happens, because of which atherosclerosis can become faster. Your body will start treating its own parts as foreign antigens and will start attacking. So tolerance can be a failure. This is how you have to remember in type 1 diabetes. Let's look at the leaderboard here. Santa, Shruti, Jwala, Vaishnavi, Nitro, Cypriya, Sneha, Shanmita, Kripa and Akshaya Nivasini. Wow, Akshaya Nivasini has entered into the top 10 for the first time, and she came at the last minute. That is what people can do to you. Come on. Next question, last 2 questions. Answer fast to get more points. The cross bridges of the sarcomere and skeletal muscles are made up of? The cross bridges of the sarcomere in skeletal muscles are made up of actin, myosin, troponin, tropomyosin, myelin. Which one? Obviously, you can eliminate one option, which is myelin. So you have to fight between actin, myosin, troponin, tropomyosin. The cross bridges of the sarcomere in skeletal muscle are made up of? 5 seconds more. Okay, so maximum number of people are given the right answer. The answer is myosin. Myosin is helpful for making the cross bridges. Actin heads are not the one that are involved. I mean, not directly involved in the cross bridges. Okay, the leaderboard. Santa, Shruti, Jwala, Vaishnavi, Nitro, Cypriya. Okay, wait. Santa, Shruti, Vaishnavi, Jwala, Nitro, Cypriya, Sneha, Shanmita, Kripa and Shirley. Excellent. So we have one last question to go, and I have one small request to make. See, it is not for the sake of this video alone. This particular session is for 1 hour. Some people might be able to see it offline also after the live session is over, and they'll be able to learn something from this. 32 questions means 32 important points from different areas with explanation of the teacher. For that, please put a thumbs up at the end of the session. I can see somebody putting a thumbs down for this session. I do not know who did this, but I believe in karma. The point here is, when we do good things should come back to us. So if I put you forward to these MCQs, that should be helpful for making you become a better person. So pay it forward. You try to help someone become a better person. That is what we try to be. So when you put a thumbs up, it can stay afloat for a longer time. Many people can watch the video later. Next question. Question 32 of 32. The last question for the day. 80-year-old man has reduced ability to see the objects in the upper and lower quadrants of the left visual fields of the both eyes, but some vision in the central region is present. What is the diagnosis? Is it central scotoma, heteronymous hemianopia with macular sparing, lesion of the optic chiasma, homonymous hemianopia with macular sparing? upper and lower quadrants of left visual fields of both the eyes plus some vision, the central vision is actually maintained. Okay, excellent. See, this is special senses chapter in physiology. Try to answer them, try to learn them. You have homonymous, heteronymous, hemianopia. Hemianopia means half the thing is gone. So when you have upper and lower quadrants of the left visual fields, for example, you will look at this side, this and this are gone, but the central area is maintained. It has to be homonymous hemianopia with macula sparing. Read that particular chapter, look at the particular picture before you go for the exam, where if you go for cross section of the optic nerve at different areas before the chiasma, at the chiasma, after the chiasma, it can help you understand scotomas better. So with this, I'll take your leave. Yes, I'll take your leave. Thank you very much for playing. Let us see the leaderboard. We'll see who came on top at the end. Okay, I think okay, so Vaishnavi ends as a topper, followed by Santa, Shruti, Jwala, Nitro, Sai Priya, Sharmita, Sneha, Kripa and Shreya. Very well played, Vaishnavi. The others also played very well. Some of you made it to the top 10. You did a great job. Thank you so much for being very honest. And subscribe to Unacademy if you could like Unacademy Live. And put a thumbs up if you like the video. Thank you very much. Have a good night. Tomorrow 9:30 p.m. If you're not a first year student, if you're crossed first year, please come back tomorrow again at 9:30 p.m. for second MBBS subjects. All the very best. Good night. Have a great day. Yes, thank you. Congratulations to everyone. All of you played very well. Even if you didn't make it to the top 10, still you are a winner because you are better than the people who never came for the quiz contest in spite of actually having the access to YouTube videos which are free. These are free classes offered by, yes. Thank you very much, Vaishnavi, Amrish. Yes, all of you. Yes, Nandri. Good night. Have a good night.